Hello. Hey, thanks so much for your support of PSR. I'm Martin Fleck. I'm the director of the Nuclear Weapons Abolition Program at PSR. And I'd like to tell you a little bit about our program. Recording this a couple days after Election Day, kind of on pins and needles. And I realize that there's a lot of things going on. You may not think very much about nuclear weapons, but it was the founding issue for PSR back in 1961, and for good reason. Back in 45, right after the Hiroshima bombing, when the Red Cross went into Hiroshima, they found that the bomb had destroyed 80% of the hospitals and killed 88% of the nurses and 90% of the doctors. And so the medical establishment realized that the only meaningful medical response to nuclear weapons is to get rid of them. So right now, our program is really oriented towards total elimination of nuclear weapons, and our motto is prevention is the only cure. You need to realize that the modern day weapons that are in our arsenal average at 14 times the power of the Hiroshima bomb. And furthermore, we have found climate science shows us that 1% of the arsenals, if they were used against cities, would cause enough climate disruption that it would screw up agriculture and could put up to 2 billion people at risk of nuclear famine. And we're spending $4 million an hour, every hour, 24 hours a day, on the nuclear weapons infrastructure here in the United States. And that's not just a waste of resources, but it's also robbing important resources from where they are needed, like building up our health infrastructure so that we're prepared for something like this COVID pandemic. One of our mottos during the COVID era is masks, not missiles. That's really what we need. It's a reframing of security. We simply can't have another nuclear war. We need to stop this madness. Someday we'll look back at this craziness and wonder how did we ever get into this situation? At the PSR Nuclear Weapons Abolition Program, we are an amazing sort of constellation of people across the country who are willing to work on this. They're motivated by a vision of a just transition from where we are into a society that makes much more sense and is sustainable. And we work with allies at the international, the national, and the local level. And our special role is to bring the health perspective to the debate about nuclear weapons. We are a partner in the international campaign to abolish nuclear weapons, and we participated in ICANN's campaign to bring about a ban treaty. Back in 2017, 122 nations adopted that treaty at the United Nations, and just a few days ago on October the 24th, we had 50 ratifications for the Treaty on the Prohibition of Nuclear Weapons, which is to say those 50 nations are declaring nuclear weapons illegal, just like chemical and biological weapons. It's a pretty exciting time, actually, to be working on this. I've been working on it for a long time. This is one of the most exciting moments for us. Now, here in the United States, the government has certainly not been supportive of that treaty, and in fact has actively opposed it. We're in the belly of the beast, and we need to get our government to get serious about negotiating with the other 8 nuclear-armed countries for total abolition of nuclear weapons. And along the way, we need to lessen the risk so that something doesn't go haywire and we have a nuclear war by accident. To give you an idea how we work in the States, I just wanted to read from a planning document here. We mobilize American citizens and especially health professionals to support the work of coalitions promoting equity, inclusion, and justice, and jointly demand from policymakers a just transition to a healthy, sustainable society that prioritizes human needs first and has no need of nuclear weapons. So the national staff is Alan Hester, our grassroots coordinator, and myself. We try to organize coordinated campaigns that involve the chapters so they can work together. This year was the 75th anniversary of Hiroshima, and so we worked with the chapters to help them to get the word out nationally about this. At the local level, all politics is local. We have a really, really incredible network of chapter activists, members, chapter staff, medical professionals in the chapters, and they are working with their members of Congress and they're, to pass better policies. They're also passing local resolutions, such as the Back from the Brink resolution and some state resolutions even. So remember that these nuclear weapons, they're either going to be dismantled or they're going to be used. So please join us in our work and help us give the next generation a fighting chance. Lord knows they need it. Thanks.